Okay, now we're back here with Dr. Dan Royal, and you just saw a very unusual video clip, and I want him to explain to you what you were watching. Dr. Dan?
Well, you're watching a video that's talking about stem cells, real stem cells. Now, when you typically go to the doctor, they'll say that they're giving you stem cells, but when you're taking cells from sources like the bone marrow or from the fat, those are not really stem cells. Those are what we call mesenchymal cells. And there may be some stem cells in there, but real stem cells are pluripotent, which means that they can develop into any germ cell layer. That means that they could develop into brain tissue, or they could develop into a liver. Whereas mesenchymal cells are simply one of those germ cells, and they will develop into orthopedic tissues or cardiovascular tissues. So they're actually good for those conditions, but they wouldn't be good for other conditions that require the other two germ cell layers, which are the ectoderm and the endoderm. So what people don't know, and this is where Larry and I worked together going back maybe 5 or 6 years, is that there's research out there that indicates that our bodies continue to make stem cells throughout our lives. You just need to know where to find it, how to access it, and then how to use it in a way that can be applied for medical conditions. So what the research shows is that basically all of our tissues make real stem cells. We call those pluripotent, again, because they can develop into any body tissue. But a stem cell will continue dividing indefinitely. It never becomes any other type of cell until it's given a signal to do so. So, for example, when you injure yourself, let's say you have broken your leg, the stem cells in the tissues will be released into the bloodstream and go to that area to help repair the muscle, the tendon, the ligament, the bone. So there has to be a signal or stimulus to get the body to make more stem cells and to release those into the bloodstream. And one of the things that we found is that there is a methodology by which stem cells can be increased in the blood from where we harvest our stem cells, which is why Larry referred to them as red blood cells, or regenerative blood cells. They don't just naturally occur in the blood. So if you go down to Mexico and they say, well, we just gave you stem cells, it's not really possible because they're not circulating there all the time. Otherwise, we'd be living forever and our body would be constantly repairing itself. There has to be a reason for the stem cells to be in the blood. And there is a particular type of supplement, although that's not the only way or means by which stem cells might be increased in the blood. We've also found that using electromagnetic field can do the same thing. But there is a supplement, primarily blue-green algae or variations thereof, that for some reason helps to increase the circulation of these particular type of pluripotent cells. In fact, there are even patents on a version of this supplement for mesenchymal cells, the ones that are primarily being harvested from the bone marrow and from the fat. But what we're interested in are pluripotent cells, which are the original real stem cells.
And you use all this technology to keep people healthy, right?
We do use this to help patients. Obviously, we don't see patients all the time who want to come in just to be healthy. Most patients present because they have a problem. So
when I was in your office today, and there was a lot of people in there. I was surprised at how many people were there. I thought maybe a movie was going to show or something. I mean, there was quite a few people there. Now, what do most people come into your office for? Do they come in for a headache? They come in because they have a heart problem? What drives somebody to go to Dan Royal Medical Center?
Well, we see a variety of patients. We see patients that come in for pain, obviously, and we see patients that may come in because they have hormone issues. Could be their thyroid or some other related hormone issue. Could be low energy, which would be a very common one. When we do blood testing, we identify that many of these patients do have inflammatory issues. They may have active virus, active fungus, infections. So we do try to identify what's going on and address those causes and put out as many fires as we can, because in regards to stem cells, that would not be the first treatment that we would use for a patient. We might do things in a series of steps. So recently I had a patient who came to me. She's had back surgery with all the laminectomy and the fusion and the hardware. She's had her knee replaced, and she's in pain all the time. In fact, a doctor recently told her she had an autoimmune condition. which when we retested her, did not prove to be true. You can get false negatives on some of these things. And she had gone to an orthopedic surgeon and wanted to have her other knee replaced, and he said, we're done replacing joints. You're just going to have to live with it. So with somebody like that, we have to take them in stages. The first stage is to get them feeling better. So we have to calm down and put out as many fires as we can. We may do that through using a simple anti-inflammatory, a combination of anti-inflammatories. So sometimes, we do use some medications, but we use the ones that are as simple as possible. So for example, there's one out there called Cortef, which is similar to what your body naturally makes. It's a type of naturally occurring steroid, but please understand that all hormones are steroids. So all we're trying to do is to raise your pain threshold. We have to get the patient out of pain and interrupt their pain pattern. The next step would be to use something like amino acids. We do IV amino acids, which is really a nutritional type of IV, but we have found that using this particular type of nutrition helps to calm down inflammation. It helps to promote the immune system and to put out those fires I was talking about. Ultimately, for someone like this, who's going to live another 30, 40 years, and I told her you don't want to be in pain the rest of your life, she's probably going to need something like stem cells. And to get to that point, we want to try to calm down as much of these other issues, put out as many fires as we can. The reason for that is if somebody came into my office and we were doing stem cells and they were in horrific pain over their body, the stem cells would go everywhere. And we want them really to go where they're needed the most. So let's say that back pain is their number one issue. We want to try to take care of as many other problems as we can before we get to that point. So in this patient, we identified she has an active virus that needs to be addressed. She has active candida antibodies that needs to be also addressed. She has inflammation in her knee, and she has fatigue. We want to try to take care of those issues so we can ultimately concentrate on the back.
You and Larry are thinking of coming up with a program where you asked me if you could find like 12 people, right? Is it 12 people about?
Correct.
Okay. And is Larry involved in that with you a little bit? Is that a different thing?
Larry might be involved if he behaves himself. I haven't really thought much
But the
about
fact
it.
is, you want to take 12 people and show them that they can improve the quality of their life by something you're going to do with them over, about a 90-day period?
Well, one of the things we want to do, remember we said earlier in the show that patients typically come to doctors when they have problems, although I will say that many of the patients we see are a different type of mentality. They're the type of patients who are investing in their health. They want to be as healthy as they can. They want to be optimally well. And so they're taking supplements. They're taking bioidentical hormones. They're exercising. They're watching their diet. They're doing all the things that most doctors ideally would like to see their patients doing, but that's not the mentality of most people. So one of the things we want to do is a simple study using some local people who are healthy, quote unquote. I want people who are not taking medications, for example. And what we will do for these patients is we will use the process by which we increase their circulating stem cells, and then we have a methodology by which we harvest those cells and concentrate them naturally so that we can give them back to the patient where they're needed. And then prior to that process, we will do what's called a heart rate variability test. We typically do this for our patients so we can monitor their response to treatment, whatever it is. It could be medication, it could be supplements. In this case, it will be to the reception of stem cells. And so what that does, that technology, which only takes a few minutes, helps us to determine the balance in their autonomic nervous system between their sympathetic and the parasympathetic. Then we will have them come back in a month after they've received the treatment, and we'll repeat that test again. Now, this is a test of which they don't have any conscious control. The autonomic nervous system controls about 90% of what goes on in your body. And so it takes about a month to see changes in that system.
This is about a 3-month process, right?
No, this will only take, depends. It could only take a month. It depends on how long I have the patients take the product. Sometimes I have them take it for weeks, sometimes I have them take it for a month.
But we're looking for 12 people.
Yeah.
And this process to do this would normally cost them about $5,000 a piece.
Correct.
Okay, and in this particular case, they're going to be very good subjects and be rewarded well for finding out about themselves when they take this particular thing. So we're going to take another break now. Do we have another tape of the doctors on this next run? Okay, so the fact is right now we're going to take a little break. We're going to come right back, and we're also going to invite our two gentlemen here, Denny and also Larry, and we'll get them back to the program. They're going to maybe do some calisthenics for us. Okay, We're going to be right back. Thank you.